Hey, what's up, guys? Thanks for watching today. So today we're going to talk about the top 5 reasons to avoid the tummy tuck. Now, let's start this off by saying, first of all, I do liposuction for a living. My Shape Lipo is my business, so I'm a little biased here, but in my opinion, liposuction is significantly better than tummy tuck for a couple reasons here, and that's what we're going to discuss today. As you can see, I'll give you all the reasons up front. So if you just want the reasons and move on, that's fine. If you'd like to stick around and hear the explanations, I'd love to have you. If you have any questions, please feel free to leave some comments, and I'd be happy to answer questions. Now, what is a tummy tuck? Now, essentially, a tummy tuck is cutting away skin. So those of you that may have the skin that kind of hangs down, perhaps you gained a lot of weight and your belly started hanging over the pubic area, and perhaps you lost a lot of weight and now you still have a bunch of loose skin. So a tummy tuck is essentially cutting away that skin. Another benefit of tummy tuck is perhaps you've had babies, you've had a few pregnancies, you may get some weakening of the muscle in the stomach, and weakening of the muscle could cause bulging of the stomach, which the tummy tuck does benefit with that, so it can help to tighten up the muscles of the stomach. Now, those are the benefits. Now, so basically, if you have a lot of loose skin and you simply want the skin cut away, tummy tuck is good. And if you have really weak muscles that are bulging out, then you may be interested in tummy tuck as well. But if that's not you, if you're the person that has an abundance of fat that you want removed, then the tummy tuck is probably not the best procedure for you, even if your belly's hanging down in front of you. And I'll tell you why. There's a couple reasons. Number one, we're going to talk about is this huge scar that you're going to get from the tummy tuck. When they cut away the skin, it's not as easy as you might think, just cutting away the skin and sew it up. It has to be done in the proper way to bring the skin together and make it look natural. So it is not easy to do, it's very difficult. So if you do choose to do a tummy tuck, you got to make sure that you get someone that's done a lot of them, and you want to look at lots of the pictures that they've done. The scars are probably the worst part of the surgery. You spend all this money, all this time on getting a cosmetic procedure, and you can have these huge scars all the way across the belly from hip to hip. So if you can see down here, it's going to go all the way across the middle, all the way to the sides of your hip, and sometimes they'll go all the way around your back as well. Now, these scars, essentially what you're doing is cutting away skin, pulling it down, and sewing it up. So the scars become a problem what happens if they pull it down and you can't even stand back up because it's so tight. So if the skin is too tight after the procedure, what happens is, if you can imagine, if it's tight initially, when you go to stand up, it's going to stretch out. It's going to stretch, and the point of weakness where the scar is, that's where things going to stretch. So that's why you may know some friends that have these terrible, terrible scars where the scar essentially stretched out, and they can go from being really tiny to big and thick. And these big, thick purple scars, nobody likes them. It doesn't look good at all. So huge scars, number one reason not to get tummy tuck. Number two is the long recovery. Recovery after tummy tuck is not easy, and I did a little research on this. I personally don't do the tummy tuck, so I wanted to find out what other doctors were recommending. And the commonality that I was finding, the average on these various recommendations was people tend to be on narcotic medication, so that's the heavy dose pain medication, for about 2 weeks after the procedure. So what that tells me is that you're going to be in quite a bit of pain for the first 2 weeks. Now, that doesn't end there. Now, people after tummy tuck, they say that you're not even able to stand up straight till about 2 weeks. So imagine this, you're walking around hunched over in pain for the first 2 weeks of your procedure. Another doctor recommended not even to start driving until 2 weeks after the procedure. So most of you probably work, like the rest of us, we have to make a living. So if you had to be out of work for 2 weeks, what would that do to you? How much money would you lose? So when you start considering cost of the procedure, the cost is way more than just the cost of the procedure to the doctor. It's the lost time on work. That's the big thing where people don't really think about. You're taking off 2 weeks of work. How much money do you make in 2 weeks? I mean, some people may make $2,000, $3,000, $5,000. You put your number in there. So As far as the rest of recovery, you're recommended to keep the compression garments on for about 6 weeks after the procedure. And they say that getting back to gym exercise takes about 6 to 8 weeks. And most people are able to get back to normal activities after about 2 months after the procedure. So the tummy tuck, the recovery is long and extended. You're really committed to this. You got to work hard at it. And if you don't stick to that, you're going to have troubles. And there's lots of complications that come with the tummy tuck. And we'll get to those on number 4 here. The next thing I want to talk about is the look after the tummy tuck. So a lot of people, you kind of have this vision in mind of what you want to look like after a tummy tuck. And it's usually not what you actually get. And the things that you want to consider, say for example, if you're at the pool and you see someone walking around and they have a little pudge to their belly here, but it looks natural. When someone has a tummy tuck, it's pretty obvious, and I'm sure that you guys have seen these people where it's pulled so tight, and they get a scar around their belly button because when they pull the skin down, they have to replace the belly button. So now you get a huge scar around the belly button, scar at the bottom here, and it looks like it's pulled too tight. It's unnaturally tight. It doesn't look the way a natural person would. So people are obviously going to know that you had something done. And some of you may not mind that, but those that do, this will be a problem for you. Just like similarly to when you get breast implants. Some people like that look, that it looks fake and they're perfect little nuggets on your chest, but not everybody likes it. So if you don't want to look fake, you don't want people to know that you've had something done, then the tummy tuck is one of those things that people are gonna know. It's gonna be pretty obvious. High risks. So after a tummy tuck, there's quite a few risk factors here that you need to consider. The surgery itself is always done under general anesthesia, and so general anesthesia, most people think, oh, that's really easy. They just put you to sleep, then you wake up and everything's fine and dandy afterwards, and it's just not the case. General anesthesia in most surgeries holds the highest risk factors out of the procedures themselves. So you're more likely to die from general anesthesia than many of the other normal complications of surgeries. So you have to really consider this, and being put under general anesthesia, you want to reduce the times that you take general anesthesia over the course of your lifetime, because every time you do general anesthesia, you're at risk of dying, you're at risk of getting blood clots, and many other, a whole host of problems that come along with general anesthesia. In addition, just so you're aware of what's going on, general anesthesia, you don't just go to sleep. They give you these medications, one of which is Propofol. You may have heard this in the news. This is the medication that Michael Jackson died from. So they give you Propofol, and this is a medication that essentially helps you lose consciousness, but a side effect of it is it stops you from breathing. So when they give you this medication, you immediately stop breathing, and the anesthesiologist will have to put a tube down your throat to help you breathe for you. So now you're hooked up to a machine to help you breathe. So I'm sure you can imagine there's all kinds of problems that can go on with the use of these machines if something happened. If you get too much of these medications or not enough of these medications, there's problems that happen there as well. So lots of issues. Another big issue that people have, the concern is infection. You have this huge incision all the way across your belly, and anytime you have an incision, you're at a risk for infection. With this, because of the incision being so large, and it's right at your belly here, you're just at a higher risk for infection. Yes, you will be taking antibiotics. However, if you get an infection, it's really bad, because it can go all the way up into your belly. It can track all the way along the scar here, and if the wound gets infected, you're going to have a terrible scar, and they may need to do additional surgeries afterwards. Just go Google bad tummy tuck scars. You'll see what I'm talking about. It's all over the place. It happens more often than you'd think. So definitely something that you need to be concerned about. The scars are probably one of the bigger concerns. I got a couple notes here. So general anesthesia, Also, you know, with the wounds, we were talking about the infection. It's also possible that the actual, when they sew the tissue up, that they can strangulate the tissue, which means that they sew it up too tight. And if they sew it up too tight, it essentially will kill the local skin. And you'll see this where the wounds start to turn black because like gangrene, where it essentially turns black along the wound, and the skin tissue dies. Again, makes the scar worse, and you have a higher risk for infection at this point. It's also, since the recovery is a little bit more difficult, you may be laid up in bed after this procedure for quite some time. And anytime you're laid up in bed, you're at a higher risk for blood clots, substantially higher risk for blood clots. It's the sitting down or laying down for extended periods of time that the blood clots can form in your calf area, and as soon as you get up and walk, that blood clot shoots up through your blood vessels, and it can go into your lungs, and that's called a pulmonary embolism. So again, another high risk for general anesthesia, as well as the tummy tuck, that you want to be aware of, and just make sure that you try to avoid these type of things. The thing that I don't like particularly is that they never do enough liposuction. And there's a couple of reasons why they don't do enough liposuction. They do charge you for it though. They love charging. These plastic surgeons, they love to charge for the liposuction, but they typically don't do enough of it. Since I specialize in liposuction, we get a lot of patients that come from around the world, and a lot of people that have had the tummy tuck and they're unhappy after the tummy tuck. And these are the common things that they say is that they leave too much fat in the upper abdomen here. They don't get enough fat along the sides, so you don't get that hourglass figure, that waistline, and they certainly aren't able to get towards the back. And the reason for this is when they do general anesthesia, they put you to sleep. You'll be laying on the bed flat on your back, and that gives the surgeon access to the front of your stomach to do what they need to do the tummy tuck. Now, if they need to get the fat back here to do liposuction, when you do general anesthesia, it's a sterile procedure, so it's difficult to turn the patient from side to side. So because of that, they tend to have poor angles, and they don't have the proper positioning to get the best results with liposuction. So that's one of the big reasons why they don't get the same results. Another reason why they don't do as much liposuction, they tend to leave more fat behind, is that when you do liposuction, it's basically breaking up all the tissue in the area, sucking out the fat, but it also damages some of the small blood vessels that help to feed the skin and feed the surrounding area. So when you break it up with liposuction, it essentially degrades the blood supply. And remember, you're going to have this huge scar all the way across your belly that the surgeon's primary goal is to get that wound to heal. And if that wound doesn't heal, that's where the major complications come. You're going to have the wounds opening up, you got infection, you got death of the skin tissue. So nobody wants these problems. You don't want them, the doctor doesn't want them. It's really bad. So to avoid those type of things, what they do is they just simply don't do very much liposuction. They take out some of the fat, they do a little bit of sculpting, but they tend to leave a lot behind. And you know, it just depends on what your expectations. If you want all your fat removed, then the tummy tuck is not the best way to go. You should get the liposuction first. So my recommendations, if you're looking into a tummy tuck, is to first, you have to consider all these things. You just have to be aware. Knowledge is power. So the more that you know about these procedures, the more likely you're going to make the proper decision for you. Now, if you want the fat removed, if that's your primary goal is to get the fat removed and be smaller, then liposuction is best for you. Now, if you have only skin, say you've lost 100 pounds and you just have a lot of loose skin hanging out and not very much fat around you, but just a lot of loose skin, tummy tuck is by far better. If you don't have the fat to remove, then liposuction is not good for you. Tummy tuck is better if it's just the skin. Now, what happens if you have some fat and you have some skin? What do you do in that situation? Well, my opinion is that in those situations, and I have lots of patients that are in the same boat here where they have fat and they have some looseness of the skin, they're worried about looseness of the skin. So what I suggest is do the liposuction first. I am substantially more aggressive than any other plastic surgeon that's doing a tummy tuck. We get out a tremendous amount of fat and make you substantially smaller. You're going to get the biggest, most dramatic change with the liposuction, at least with my shaped lipo. Now, when you do the tummy tuck, the liposuction is not as much, so you're not going to get as big of a change. And what was I just talking about? I'm sorry. We're doing these live videos. We were talking about the liposuction is better than the tummy tuck because we can get more fat out of there and get a bigger change. Now, okay, we were talking about the person that has fat as well as skin. So with the liposuction, we're going to get all the fat out first. The skin does retract. And if you're trying to avoid a tummy tuck, we can use the Smart Lipo laser for skin tightening. And studies show that the Smart Lipo laser can get you up to 57% more skin tightening than liposuction alone. How that laser works, you might be interested in getting your skin tightened after liposuction because you're trying to avoid a tummy tuck. So these people, we recommend using a Smart Lipo laser, in which case you pass a laser underneath the skin and it heats up the inner surface of the skin, causing a contraction. It's also been shown through studies that it stimulates collagen growth for about 6 months after the procedure. So as you heal, you continue to get more and more collagen growth with a maximum benefit about 6 months down the road. Now collagen is the material in your skin that we are all losing as we age. The collagen gives your skin the thickness and the elasticity. So if we can create more collagen in the area, then you'll get thicker and tighter skin with a maximum benefit about 6 months out. So back to this person that has fat and skin. We recommend doing the liposuction first. Get out as much fat as we can, make you substantially smaller. We can use the laser to tighten the skin, get you 57% more skin tightening than liposuction alone. So the hope is that these people will get enough skin tightening and get enough fat out of there that afterwards they're happy with the results. And from a study with our patients, about 95% of those people ended up not going on to get a tummy tuck afterwards because they were happy with the results from liposuction alone. Now, the people that do choose this, these are the people that want a more natural look and feel. These are people that don't want the downtime. These are people that don't want the scars. You're going to get good results with liposuction. You get substantially more fat out with liposuction, but you're going to be potentially left with skin. So it's really, you got to think about your expectations and what do you want. Do you want this look where you have these scars and this your skin is pulled abnormally tight, or do you want more fat taken out, more of an hourglass figure? Do you want your skin to look normal and have a normal look to it? It may be a little bit loose, but it looks natural. And so that's typically the goal and what people are anticipating with liposuction. That's what you can anticipate with liposuction. So make your decisions. Know what you're talking about. If you're thinking about doing a tummy tuck, be aware of the risks. Be aware of the complications. Be aware of the huge scar that you're going to get. If you don't plan for it, this recovery is going to be bad for you. If you're expecting to go back to work too soon and you're not able to, perhaps you have a more physical job. Understand what the recovery process entails. Understand all the complications. Understand what it's going to look like afterwards. Research it. Bad tummy tuck scars, they happen, and it happens more often than you think. Another thing people, you may not realize is there's a deformity called the Doll Ear Deformity. When they pull the skin back, you end up getting pooches on the side because the cut wasn't made properly, and it ends up pooching out the skin on the side, and it kind of looks like dog ears, which is why I got that Doll Ear Deformity. So know what you're talking about. Understand the consequences of a tummy tuck. Understand the benefits of liposuction, and try and make a decision whether you want the bigger procedure for the tummy tuck or get something a little bit more natural looking and feeling. Also, another benefit of liposuction over tummy tuck is that the recovery. My patients go home or go back to work within 1 to 3 days. So think about this. You get all the fat stuff sucked out of your stomach and you go back to work the next day. How good is that? You've been struggling with your fat for maybe 15, 20, some of you 30, 40 years. Something has been bothering you. You've been depressed about it. It's you don't have the confidence that you once had. It's taken this long to build up this fat in the area, and in a matter of a couple hours, it's gone, and you're back to your normal life so quickly. It's kind of a no-brainer if you think about it. But if you guys are interested in liposuction, MyShape Lipo is the business that we have here. All we do is liposuction. We focus on doing liposuction. About 70% of our patients fly in from out of state. So don't be scared if you're seeing this and you're in Rhode Island or Connecticut or New York or Miami. They're coming from all over the place. Canada, about 7% of our patients are coming from Canada. So give us a call, 702-818-5476. That's 702-818-5476. And we do have a contest going on right now for free liposuction. Can't afford it? We got a deal for you. Free liposuction. 3 free areas. Go to our website, myshapelipo.com. You can sign up there. We have a new deal where you can actually text in. So text free lipo. That's the word free lipo, all one word. Free lipo to 44222. That's 2 4s, 3 2s. 44222. Text the word free lipo to enter the contest. Alright guys, thanks for listening. If you have any questions, please leave your comments down there and I'll try and answer them as much as possible. And hope to see you guys for next time. Thanks a lot.